Okay, so I want to preface this by saying I'm not a doctor, I'm not a clinician of any kind, I'm not a psychiatrist, I'm not a psychologist. This is just my opinion, and take everything I say with a grain of salt. So I don't doubt that you probably have people in your life, or you yourself, have gone through something, and as a consequence, have feelings of depression, or feeling depressed, or something of that nature. And at least from my own experience and testimonies from other people, and as far as even the clinical literature is concerned, something like depression, it's there's a distinction between feeling depressed and having a terrible life, right? So you could display symptoms that would, in all likelihood, be correlated with a diagnosis like depression, but and treatment for that is generally pharmacological, which has its place. I'm not saying that pharmacological intervention is useless or without its merit, because it certainly is, and I'll make that point in a moment here about when I feel that is appropriate. So if someone came to you and they said, "Oh, I'm feeling unmotivated. I struggle to get out of bed in the mornings. I'm goalless. I'm aimless. Having some ideation of some sort." And they're like, "I don't know what's happening. I don't know why I feel like this," or perhaps they do. But let's just say you could ask them a standard set of questions, something like this: Do you have a job? Do you have a job, and are you satisfied with your career trajectory, but at the very least a job? Do you have an intimate relationship? Do you have a group of friends that you can trust and rely upon in a crisis? Do you sufficiently manage your temptation to drugs and alcohol? Are you educated commensurate to the degree of your intelligence? I guess you could throw management to temptation of drugs and alcohol. You put gambling and pornography in there as well. So what's that, like 5 dimensions? I think that's sufficient. And so if you're not functioning on at least 2 or 3 of those, it's like it's absolutely no wonder why you feel depressed. It's not that something's not firing right up here, or you have a chemical imbalance, to use like a overused cliche. It's the fact that your fundamental orientation and the circumstances of your being are not operating nearly as well or as optimally as they should be. And so as a consequence of that, you feel anxious, you feel depressed, and oftentimes much more than that. And so from my analysis, mental illness is actually something quite rare. Because people, if you're overwhelmed by catastrophe and complexity, and you stack that on top of someone who's already struggling, it's think about it this way. So you take a balloon, right? You blow up a balloon, and once you blow it up beyond its tolerance, it's going to blow out at its weakest point, right? Wherever the hole is, that was the weakest part of the balloon once you push it beyond its tolerance, and it pops, right? So your genetic predisposition, in some way, works exactly like that. So if you're stressed out at work, or you get laid off, and one of your family members develops an illness suddenly, and your partner cheats on you, something like that, you've encountered like a trifecta of catastrophe there, and you don't know what to do as a consequence, and your health will deteriorate in one way or another if not managed properly. The problems I'm speaking to. And for some people, that could be drinking. For some people, that could be drugs. For some people, that could be pornography. For some people, your genetic predisposition might lead you to developing an autoimmune disorder or burning out or a food intolerance. Like there is a comprehensive, almost infinite list of things that can happen. And when you're so overwhelmed by the vicissitudes of life, wherever you land on that kind of arbitrary distribution of genetic predisposition, that's where you're going to blow out at your weakest point. And for addicts, that's, drug abuse or alcohol abuse. For some people, they might have a certain physical fragility or biological fragility, and they could develop, arthritis. They could develop heart disease, something like that. And this isn't there's many causes for all of these things, but this is just something to think about. So as far as pharmacological intervention, because if you go to a GP, right, and you tell them that, you're having these feelings, they're going to generally standard practice or standard method of approach for assisting you is going to fill out a K10 or a DAS, something of that nature. And based on how you answer those questions, you will receive a score. And based on that score, will determine whether or not you have, at least initially, tentatively have a mental disorder, illness, whatever you want to call it. And generally the first step from there is to offer you some kind of medication. I think the circumstances where that's appropriate is when you're functioning well on all of those dimensions, right? So you have a partner, you're in a job that you're satisfied with, you've got a group of friends that you see regularly that you can trust. You're not an alcoholic, you're not a drug addict. Let's just stick with those for now. And even with all that, and you're still really struggling to get out of bed, you're unmotivated, you're aimless, you're existentially anxious, pharmacological intervention at that point has tremendous utility. And I think it's important just to make that distinction because, you could take a fairly low dose generic antidepressant, even if you're not functioning well, and it might be able to increase your stress tolerance or something like that. But the more appropriate thing to do is to address the fundamental pillars on which your life rests. So if you're not operating on any of those or very few of them, get those in order the best way you know how, one step at a time, incrementally. Don't just gung-ho it, because that's in all likelihood not going to work. And if you're still feeling that way, then that's when you could probably consult with the doctor. But I'm going to say I am not a doctor. I'm not a psychologist or a psychiatrist or a clinician. So this isn't advice. This isn't me telling you what to do or how to think. This is simply what I think, right? So I think I'll leave it there, but it's just something to think about. And see you guys in the next one. Cheers.